Welcome, everybody. Thanks for being with us for today's session on leveraging mainstream systems. This is a session in a series focused on helping. Sorry, I'm getting a little feedback here. One moment while we resolve that. If you are joining remotely and could mute your line when you're not speaking, that'll also be helpful. Great, that seems to have taken care of it. So this is the third information session for Homework Starts with Home, following on different elements of the Homework Starts with Home practice model, really intending to help potential applicants for Homework Starts with Home think about how they could incorporate those various elements of the practice model into their work. So today's topic is really focused on the role that mainstream systems can play in helping to support people who are at risk of or experiencing homelessness or other forms of housing instability. And before we get started, just want to share a couple of important logistical notes. This session is being recorded, the slides and the audio, and may be posted publicly, so just please be aware of that. We intend to leave a lot of time at the end of the session for your questions, and as you'll see in a moment, we'll also provide a way for you to ask questions throughout the session. For those of you here in the room, just make sure you get your parking validation before you leave to cover the cost of your parking. If you're joining remotely, please make sure that the audio controls on the webinar are muted and that they're orange when they're muted, or mute your phone if you're joining by phone. Please also make sure not to put us on hold, as that can lead to hold music, which can be pretty disruptive. Last little logistical reminder is that we will not be monitoring the chat function. So the way that we're going to really look for your questions is through the tool that I'll cover in just a moment, and just having folks chime in with their questions directly. To help kind of facilitate participation for those in the room and remotely, we are encouraging you to use the menti.com tool today. And so either in a web browser, if you're at a computer, or on your mobile device, if you go to MENTI.com and enter the code 51303, that will give you an opportunity to respond to questions that we ask you, but also to pose questions for the panelists today to cover as they get to the Q&A section of the presentation. And just to start that off and make sure that everybody has access there, we've created a poll that you can participate in right now. So again, you want to go to menti.com, MENTI.com, and then enter, when you're prompted, enter the code 51303. And we just wanted to get a sense of who was with us today in some broad categories that are included in the survey. So go ahead and take a minute to fill that out. We'll give folks just another minute to put in their responses. We've got some popping in now. All right. Now we'll introduce, so it looks like, I should say, it looks like we've got a mix of folks from schools and educational settings, public housing agencies, homeless service organizations, and other categories. So appreciate you all being here with us for today's discussion. In terms of introducing today's panel, I am Eric Grumdahl. I'm with the State Department of Education and the Minnesota Office to Prevent and End Homelessness. I'm joined by Amy Stetzel, who's the Director of Plan Implementation and Community Engagement for the Minnesota Office to Prevent and End Homelessness, and Alison Niemi, a Policy Specialist with the Minnesota Department of Human Services and the Office to Prevent and End Homelessness, and Pete Bernardy, who leads the results management team for Minnesota Management and Budget. And they'll each have a chance to say a little bit more about themselves and their work as we go into the presentation. We wanted to start off by really just putting out a starter definition, really a preliminary definition for really the focus of our conversation today around mainstream systems. And mainstream systems in the context of work on homelessness are usually distinguished from targeted programs. Targeted programs are those that are specifically really focused on people experiencing homelessness, whereas mainstream systems typically serve a much larger group of people. You know, they certainly may have their own eligibility requirements, but those are generally broad. And importantly, they don't specifically focus or only target people who are experiencing homelessness. But importantly for today's conversation, those systems can be really critical in the context of creating housing stability for people that are facing housing crises when those individuals and families are able to actually get connected to those systems. So I see that somebody's already participated by kind of providing an example. I'd invite others to chime in with examples as you're thinking about your landscape, what mainstream systems or programs you might encounter. So SNAP is another good example. The program kind of formally described as food stamps. Supplemental Nutritional Assistance Program, I think is the acronym, but don't quote me on that. Housing Choice Voucher or Section 8 housing subsidies, I think is another good example of a mainstream program. With Housing Choice Vouchers, it's worth noting that there are some sub-programs within the Housing Choice Voucher program that are targeted to homelessness, but the program by itself is a large program that is targeting a lot of different populations, broad populations. Any other examples folks want to chip in? MFIP, another great example, absolutely. The Minnesota Family Investment Program, Minnesota's version of the Temporary Assistance for Needy Families, or TANF program. That's great. So I'm now going to hand this off to Amy Stetzel, who can talk a little bit about the way that the state has engaged with this topic of the role of mainstream systems in ending homelessness. So Amy.
Great, thank you, Eric. So the Minnesota Interagency Council on Homelessness is made up of 11 state agencies, the Governor's Office, and the Metropolitan Council. And back in 2014, this interagency body was really brought up to be much more of a cabinet level policy-making body. And we've had a handful of, actually 3, we're on our 3rd statewide plan, which I'll get to in a little bit here. But I just wanted you to see who the players are who are making up this interagency council. It's everyone, as you can see, from corrections to public safety to transportation to people you would probably guess, such as Department of Human Services and the Department of Health. And our vision for the Interagency Council is housing stability for all Minnesotans. And that vision has remained true since we launched our first plan in 2015. And as Governor Dayton, you can see his quote here, we know that stable housing results in better educational outcomes, stronger workforce, increased public safety, better health care, and reduced disparities among communities. So as I said, we launched our first statewide plan in 2015. That's the red plan on the left. Both the red and the blue plan, named Heading Home, Minnesota's Plan to Prevent and End Homelessness, were very state focused. We really were focused on what state agencies can do and really wanted to get ourselves in a place where we felt really coordinated and connected, and we're doing this work in an interagency way, but really focused on only what state agencies can do, knowing that we have these partners across the state, such as counties, our continuums of care, our schools, our public safety folks on the ground, who we absolutely need to be a part of this work in order to do this work well. And so our latest iteration of the plan, Heading Home Together, really brings in all those other partners into this work with us here at the state. So the wheel that Eric is going to slide to, there we go. This is just a snapshot showing you what is inside the Heading Home Together plan. So you can see the vision, housing stability for all Minnesotans, is there in the middle. Our 4 population goals are around that: veterans, chronic, families, and youth. And then the green circle indicates what we call the 7 principles of the plan. So those are really talking about what are the 7 big, not basic, but critical ingredients we need to ensure that we are preventing and ending homelessness for all Minnesotans. So that's talking about identifying and engaging people, ensuring a crisis response, rapidly linking housing and services, filling the gap in housing, using a person-centered approach, increasing our employment and income, and organizing all the different plans and partnerships that we have across the state. Now, when we say we're going to prevent and end homelessness for veterans, families, youth, and those who are chronically homeless, what we mean is that preventing and ending homelessness doesn't mean that no one will ever fall into homelessness ever again. What it means is that we will prevent homelessness whenever it's possible and otherwise make it rare, brief, and non-recurring, or only happening once. So we want systems in place that ensure that we are decreasing or preventing the new incidents of homelessness as they're coming into the system. Those episodes are as brief as possible to reduce all the trauma that happens and occurs when families and individuals become homeless. We're increasing our housing outcomes, ensuring that homelessness is rare as possible. And then we're cutting that cycle where people get out of homelessness and then fall back into homelessness. And so we're making it one time. So that's the system we want to build in our communities across the state to ensure that we are indeed preventing and ending homelessness. So now I'm going to hand it off to Alison Niemi, who's going to speak some more about how the work we've done around mainstream systems and how we've applied that work here at the state.
Great, thanks. As Amy just mentioned, I'm going to talk about one of the major pieces of work that has come out of the Minnesota Interagency Council on Homelessness, actually from the very first iteration of our plan. And it's an initiative that we call Foundational Service Practices. And this is a set of guiding principles designed to improve access to resources that can help prevent or end homelessness for families and individuals. These practices were developed because we recognize that people experiencing homelessness were often unable to access mainstream systems to the same extent as people who are more stably housed might be able to. If you have any experience at all with some of the mainstream programs that we talked about in the beginning with our poll, MFIP or SNAP, the housing voucher system, you know that it can be kind of confusing to navigate those systems and difficult to do at times. And we recognize that those barriers that most people experience are compounded by some of the conditions of homelessness. If you're moving around a lot, you're not stable, you don't have any basic resources, it can make these systems even more difficult to navigate. And on top of that, most of these programs are not structured and their operations aren't designed to specifically meet the special needs of people experiencing homelessness. So it can mean that people that maybe should be eligible for and receiving these programs or services are not accessing them as they maybe could be. So in order to address these issues, we decided to come up with some practices that all mainstream programs should look at incorporating into their systems and implementing with the people that they serve. These practices were informed by interviews with key partners from around the state. So a number of our state staff that work with the Interagency Council on Homelessness actually went out and interviewed people experiencing homelessness, case managers, people working at counties and different service organizations to get really a better sense of on the ground what are the barriers that people are facing in accessing these types of programs. And then we also looked at some national research that has been done around this issue. There's a number of current federal and state guidelines that address these issues. And we talked to program subject matter experts as well. And all that information was incorporated and kind of put into these 5 practices that I'll go through now in more detail. One of the major things that we learned from those interviews is this quote that we kind of use often because I think it's a really good example. It really paints a picture of why we want to have these practices in place. And it came from those interviews. Someone said, "What's hard for people who are housed is impossible for people who are homeless." And so that's kind of the guide for looking at implementing these service practices. The first practice is to know the housing status of the people you are serving. So the idea here is that if we don't ask the question and if we don't know where people are in terms of their housing and how stable they are, on an individual level, it's hard to kind of accomplish the goals of whatever program you might be having. Let's say you're working on improving mental health. It's obviously really difficult to do that if somebody's not stably housed and you're not able to address that. And then on a systems level, it's important to know people's housing status so that we know we're reaching the right target population and we know if it's working or not for that group. So some of the things that you can do around this service practice is, first of all, just make sure you're asking the question and collecting that information and storing the data in a particular place. And then also have some sort of response protocol so that people aren't simply asking the question and then moving on, but that whoever is asking the question has some resources that they can help connect the person to or know about resources in their area that they can make referrals. The second practice is to actively reach out to people experiencing homelessness. And the idea behind this is that when someone is experiencing homelessness, a person or a family, they are primarily concerned with meeting their day-to-day needs. Where are they going to sleep tonight? How are they going to eat? How are they going to get their kids to school? And being able to look for kind of resources that might help them more in the long term is difficult. So we want to make sure that we're not expecting people to come to us for our programs, but we're actively reaching out to them. We need to have simple, easy, and clear instructions. One way to do this is also to connect with services, staff, for instance, people that work in the shelter and know the individuals and families who are experiencing homelessness and make sure they know about the resources and can point people to the right places. And as much as possible, going to where people already are, going to the shelters, going to drop-in centers, to food shelves, wherever people might be going so that they can learn about your services without having to take an additional step. Service practice number 3 is to limit requirements for in-person appointments at a particular location or office. So I feel like a number of our mainstream programs require in-person appointments and interviews, and I think it's worthwhile to really examine whether that actually needs to happen in person or if there can be alternative ways to get what you need. And this is because people experiencing homelessness maybe even have extra burden on them in terms of being able to attend these appointments. They are moving from place to place and have a difficult time getting to the appointments. So we want to lessen that burden as much as possible. And we want to think about that at application time, when people have to reapply, what do they have to do to receive the services or benefits, and if they just want to ask a question, is it easy for them to contact someone to ask a question about their benefits or services and find out what they need to do to keep their benefits. Drop-in hours is another good way to address this, so you don't necessarily have a set time, and we want to make sure that services are not cut off or dropped simply due to missed appointments. Service practice number 4 is about assisting with the process of gathering required verifications or documentation. So in applying for these programs, there's often a lot of documents, verifications that you need to collect and provide. And this is especially difficult if someone is experiencing homelessness. They maybe don't have a safe place to store them. They don't have a permanent address. It makes it harder to access these records. And so what can we do to make sure that this process is easier for them? One thing is to look at how you can share data between agencies. So instead of actually requiring the person to go and physically get some sort of verification or documentation that they need, can we transfer it electronically? Having people available to help with the application is useful. Providing some extra response time or other lenience if needed if the person is experiencing homelessness. Having some funds available to help with getting documents, because sometimes it costs money to get, the things that you need, birth certificates or whatnot. And then having a place that is available for people to store their documents if they don't have a safe place to do that. And we actually have a statewide resource that people can access to do this. If you haven't heard about it, we have a website that is sponsored by the Department of Human Services, and it's called Housing Benefits 101. And the way you get to this website is probably the easiest one is to just Google Housing Benefits 101 Minnesota. Make sure that, or HB 101 Minnesota. This is a great website. If you haven't seen it yet, I would highly suggest checking it out. We go through a number of different types of housing options for people and programs and services that are designed to address housing. And one of the features on the website is called My Vault. And so My Vault is a place where people can do different activities around planning for housing. So we have a number of tools that you can go through and answer questions about what you're looking for in housing and maybe how you can access it. And we also have anyone who signs up to get a My Vault account is able to store documents there for free. It's secure, and they are also able to share them with others if they would like to. And so it might be a good setup for somebody who wants to share with a case manager or advocate that is working with them. The account is free, and it's all controlled by the person themselves, so it's secure. And then our last service practice is to allow for multiple methods to communicate about benefits and services. This one's kind of obvious in some ways, but if somebody doesn't have a mailing address, if they're not have a stable place to live and able to receive their mail, that can be a huge issue. And I know it is a huge issue with a number of our programs at the Department of Human Services. So we're trying to push for allowing for more ways to communicate about our benefits and services. And then allowing people a choice in how they want to receive their information. Do they want to get them by email, by text messages? Do they want a phone call? Do they want a carrier pigeon to deliver their benefit information to them? That would be very impressive. But those are some kind of ways that we can think about, leveraging the technology that's available today that we can use to communicate better with people. And another option is to allow for a third-party contact person or authorized representative, so that if the person doesn't have a good way to communicate with others on a regular basis, that there's a trusted person in their life potentially that could receive that information and pass it on to them when they see them. So those are our 5 foundational service practices. We have them all listed again on this slide as kind of a recap to remember them. And we have a number of examples from around the state and different programs of how we've actually implemented these. And I'm going to pass it on now to Pete Bernardy to talk about some of these.
Hello, so I'm Pete Bernardy from Minnesota Management and Budget, and one of the things that my agency does is help coordinate interagency efforts, and so I'm going to tell you a little bit about one of those efforts and how it's related to foundational service practices. The effort that I'm talking about is called Results for Children and Youth, and we've been meeting at least every month or two with 9 state agencies, including the Departments of Education, Housing, Human Services, Health, Higher Education, Employment, and more recently the Metropolitan Council and Departments of Transportation. And our goal is to explore ways for the state and its policies and its systems to better support the local partners and individuals that play a role in the lives of children and their families. And as reflected on this slide, the goal is for them to be able to thrive and ultimately contribute to the state's workforce and in other ways as citizens. Obviously, the context in Minnesota is that we actually do really great by national comparison standards overall, but we have intense disparities, and our systems have a role to play in addressing those disparities. The goals that we have been working towards are sort of broadly encompassed in the idea of all children experiencing safe, stable, and nurturing environments and relationships wherever they are, whether that's home or school or in the community. And we sort of have academic focused outcomes that we're oriented to, but all of our conversations are very cognizant of the social determinants, sort of the broad set of things that need to go right for children, for them to grow up and have a thriving adulthood. So moving on to the next slide, one of the specific things that this interagency group decided to take on was to apply the foundational service practices that Allie just described to a handful of child-serving programs funded or administered by the state. And so that list of programs is listed on this slide. One thing that I would mention is that most of these programs are not directly administered by the state, which means that we have local partners that are actually on the ground interacting with the individuals that they're serving. And so as we were walking through each of the individual foundational service practices with each of these programs, much of the discussion was around in what ways does the state have laws or policies or administrative procedures that enable these foundational service practices or prevent those foundational services practices from being used with actual families. And so in each of these areas, we've identified a few things that we can do to make it easier for those serving families to apply the foundational service practices. In some instances, that is merely just communicating resources that are already available. In other instances, that is looking at whether there's things that could be changed that would make it easier for local partners to apply the practices. And as I conclude talking about this project, I think one thing I would really emphasize is we very much see the projects that will be funded through the Homework Starts with Home initiative as being an opportunity for us to learn more about the ways that state systems, policies are impeding local partners from applying these principles. So to the extent that there are things that we didn't find when we put the mirror in front of our face and said, what are we doing well, what are we not doing well? To the extent there are things that you or others identify through the process of implementing this initiative, we're very interested in bringing those back to this interagency group and having that inform potential changes to the broader system and the broader set of policies.
Great, thank you, Pete. So you've heard a lot so far about just some of what state government is doing and how state agencies are organizing themselves to make their mainstream programs work as well as they possibly can for people experiencing homelessness. But I also wanted to point to some important federal guidance, particularly some of the work that the U.S. Interagency Council on Homelessness has organized among its 19 member agencies, and a great resource that's on the screen here called Enlisting Mainstream Resources and Programs to End Homelessness. I think one of the things that's interesting as the federal government has looked across its portfolio of programs, they've identified mainstream programs that can provide kind of direct support for people experiencing homelessness. So if those programs work better, more people who are facing a housing crisis can access them, or the services that those individuals or families receive will be more helpful in interrupting homelessness. They have also, though, identified ways that those mainstream programs can bolster or even finance the work that's happening for targeted programs. And so I think it's an interesting blend of approaches to consider as you look within your community at the potential mainstream programs that could be part of your local solutions to homelessness, to really think of both of those buckets. So the specific resource, that document enlisting mainstream resources and programs to end homelessness, is essentially a compendium of all of the existing federal guidance across multiple federal agencies around how their programs can work. It is the starting point for thinking about the role that some of those federal programs can play. And I think one of the important things to understand, and this kind of echoes a point that you heard Pete and Allie make earlier, it is one thing to be able to provide guidance, and a lot of what the federal government and the state government are able to do is provide guidance. It is really a matter of local discretion whether that guidance is implemented. And so I want to just have folks really appreciate that I think both the federal government and the state government are trying to create very clear pathways that communities can use if they wish with these programs. But the decision to actually do so is not one that in many cases can be made at a federal or a state level. It really has to be made locally. And so there's a role for all of us in that partnership and being able to make sure that that's happening. So this URL, this web link at the bottom of the slide that's on the screen now, is a short link to the USICH resource that's on the screen. That resource contains almost all the other references that I'll cover in the next couple of slides. So if you remember only one link, tinyurl.com/USICH-mainstream-systems will get you to that document. Or you can just do a web search for the title. Either way will get you there. So some of the work that's happened around mainstream programs has been specifically focused on the role that public housing agencies can play across the whole portfolio of their resources, not just the ones that are already targeted to homelessness. CSH actually led off a lot of this work with the development of its toolkit, which is conveniently called the PHA Toolkit, really focused on the role that those public housing agencies can play, and also partnerships that can be created between PHAs and those other organizations. HUD actually picked up a lot of those ideas and incorporated them into some guidance that it has issued as well in a resource document focused specifically on the partnerships between continuums of care and PHAs. And then I'm also happy to say that Minnesota Housing, in partnership with the Minnesota chapter of NARO, developed a guide in 2016 called Achieving Housing Stability Together that is also available on Minnesota Housing's webpage, really looking at 6 particular opportunity areas where stronger partnerships between public housing agencies and other organizations could have significant impact on ending homelessness. Across these toolkits, there's a lot of overlap and similarity because there are some strategies that have really bubbled up from the places that have implemented them as being particularly powerful. And so I hope those are helpful resources as you think about the role that PHAs might play in your own local response to homelessness. The Federal Department of Health and Human Services also issued an information memorandum, one of their kind of official vehicles for communicating with the field, in 2013, specifically focused on the role that TANF, the Temporary Assistance for Needy Families program, can play in ending homelessness. And I think for many communities, really identified possibilities and opportunities that aren't widely implemented, including the idea that TANF, for example, can provide ongoing service funding that's intended to help people stabilize and transition ultimately off of TANF or MFIP benefits. So there is again a federal element in providing that guidance and permission, if you will. There's state support for thinking about how that guidance gets implemented on the ground. And then really, again, that's an area where it is typically a county decision around whether and how that particular permission or opportunity is adopted in the context of an approach on TANF. And so if you have questions about that, DHS can provide some more background and context around how TANF could play into your solution to homelessness, but I think more importantly, it's really critical to have strong partnerships at the county level within your economic assistance departments of those county governments around the ability to do so. There are a couple of guides around the role of education focused both on early childhood programs and early education. Some recent work that's happened through the Administration for Children and Families within the Federal Department of Health and Human Services, focusing really on ways that early childhood programs can play a really impactful role and amplifying, frankly, some of the guidance that already exists for early Head Start and Head Start programs around their focus on serving homeless children. In addition, both the Federal Housing and Urban Development Department, HUD, and the Federal Department of Education have collaborated on a number of documents, most recently a piece that's focused really on fostering cross-system collaboration, in particular between schools and their McKinney-Vento homeless liaisons and continuums of care in having effective responses when students are identified. In 2014, the Department of Labor and USICH convened a number of communities from across the country. Hennepin County and Ramsey County were invited to participate in that convening as well, and created a document and a resource report called Partnerships for Opening Doors, really focused on the way that linkages between workforce systems and homeless response systems can help both systems achieve their goals more effectively. There's been a lot of work happening in a small number of communities following up on that invitation, that event that occurred in 2014. And the report has a number of recommendations from some of the strategies that those communities have tried. I also wanted to amplify just a couple of other ways that programs can have a really significant impact, even regardless of exactly how they might implement either federal guidance or the foundational service practices, or might come up with their own approach. And one is MDE's Early Learning Scholarship Program, which I think has really approached this challenge with gusto, trying to identify ways not only to create easier paths for families and children to get connected with that program, which helps defray the cost of high quality childcare programs for young children, and be able to make those scholarships work effectively even through the transitions that a homeless family might experience. So if the family gets connected with that scholarship in shelter, being able to retain that scholarship and continue to use it after they transition out of the shelter and hopefully into stable housing. Some simple examples some of the examples of the ways that they've done that are to create expedited review for any applications for homeless families, really trying to prioritize those families getting connected to the program quickly, and also being able to feed back to the administrators of those programs what they're seeing in terms of their success enrolling homeless families. It's been a really remarkable and rapid transformation of the impact that program has had. DHS's Child Care Assistance Program also has adopted a variety of policies that, although they are certainly beneficial for people experiencing homelessness, they really benefit people who are in any kind of transition or crisis. And so just as some specific examples of those changes, really looking at a longer period of time between eligibility redeterminations to allow people really to stabilize and not have to constantly be keeping up with paperwork and risk potentially losing their access to that program if they didn't comply. Being able to extend eligibility so that as quickly as possible when somebody's identified, they'd actually be able to get connected to that program rather than have to go through such a long and arduous process that they would kind of lose the benefit that program could have if it was available more quickly. And in addition, DHS has identified a number of other specific strategies that it's pursuing along these lines. So, again, that's an example of a set of practices that are going to benefit a large number of people that will benefit from better access to that program, and certainly including people experiencing homelessness. So, we've now come to the part of our session where we really want to hear from you. And so would invite you to either use the Menti tool and to add your questions to the mix here, which will show up on the screen by going to menti.com and entering the code 51303, and then filling in a question if you have one, or alternatively, to just take yourself off of mute and chime in over the phone or in the room. So any questions about what we've covered today or how it might relate to your work locally? So we've got a question that's come in here. Is social media being used now by state agencies as a way to consider communicating with families? Who'd like to field that question? I don't think we are aware of any specific ways that social media in particular has been used, apart from broad communications about programs or eligibility. But in terms of specific communication with, for example, somebody who might be applying for a benefit, sending them a message on Facebook or Twitter or something like that, I'm not aware of any ways that that's being used right now, but it's a good question. Any other questions? So we have another question here about does the state share these resources with counties? And I'm going to pitch that to Allie and Amy, who I know have had some conversations along those lines, whichever one of you wants to go first.
So this is Alison Niemi from DHS. So I don't think that across programs we've had a consistent way of sharing the foundational service practices with counties, but by program we have some different examples of right now. I believe in the child safety and permanency area, they're working on doing either a bulletin or a memo about them. We've done some online trainings for actually the public housing authorities at Minnesota Housing. So it's kind of by program that depending if they have like training set up or different communication strategies, but other ideas of how we could get that information out to counties that would be effective would be welcome.
And something I'll add too, Alison and I have been meeting with the Association for Minnesota Counties, as well as MACSA, which is the Minnesota Association of County Social Service Administrators. It is the longest acronym ever. But we met with them numerous times to talk about the plan, our newest Heading Home Together plan, and what should be in that plan, and how counties really have just this really strong and unique and necessary role to play in preventing and ending homelessness. And so we can use both AMC and MACSA as a vehicle. I actually wrote that down in my notes. Bring the foundational service practices to AMC and MACSA. Both of those entities have signed on to the plan to say we're signed on saying we are going to go after these same goals. We love this vision of housing stability, and we're going to frame our work alongside you kind of under these 7 principles that are outlined in the plan. So I think counties play a huge role in all this work, and I think we could all do a better job of engaging with them.
The other thing that I will just add to that is that the foundational service practices themselves are actually included kind of throughout the Heading Home Together plan, but then called out specifically by themselves as one of the appendices of the plan. So that can also be a helpful tool as you're engaging other partners or having conversations locally about what implementing some of those practices might look like in your community. All right, well, those are great questions. Why don't we give one last call for any other questions that folks either want to add into menti.com or chime in over the phone? Going once. Going twice. All right, well, thank you all so much for taking time today to be part of this conversation. Before we adjourn, I just wanted to share with you some of the upcoming sessions and give you a little background on the trainings that we have scheduled for the next 3 weeks. Next Friday on the 18th, with a shorter time than was originally scheduled, hopefully making it easier for folks to participate, we have Catherine Gale, who is the co-author of the Federal Framework to Prevent and End Family Homelessness, coming to talk about progressive engagement, which is really the central strategy of that federal framework. She'll be with us for a training that starts at 10 a.m. next Friday. That'll be followed by a session with Colleen O'Keefe from the Sauer Family Foundation, focused on trauma-informed care in schools, talking about some of the work that Sauer has supported and implemented along those lines. That's on Thursday the 24th at 1 p.m. And finally, on Thursday, May 31st at 1:30, we have a session with the architects and implementers of the San Francisco Schools Hamilton Family Services pilot, which was a really innovative way to connect any kid or any student or family identified in a school context with support to rapidly resolve their housing. It started as a Google-funded pilot initiative and has now grown into a citywide campaign to end family homelessness. And so Jeff Kaczynski, Mary Richards, and Tamika Moss will be with us to talk about their work and where they see it going next. So we hope you can join us for those sessions. The registration link is at the bottom of the screen there. All 3 of those sessions will be at the Department of Education, located at 1500 Highway 36 West in Roseville. Finally, here are a couple of additional links that you can access for more information about Homework Starts with Home, both the MDE page for Homework Starts with Home and Minnesota Housing's multifamily grants page, which summarizes the actual application material. As a reminder, applications for Homework Starts with Home are due June 4th at 4:30 p.m. Central Time. If you have any questions about your application or anything else related to Homework Starts with Home, please contact Diane Elias at 651-284-3176. Thank you all so much and enjoy the rest of your day.